Hi, everyone. I'm Randy Bradley representing Team Diffuse. And today, what I want to do is present to you our solution to address the challenges and issues raised by Eastern Health, but issues that are also faced by so many health systems around the world. So before I jump into the solution, let me present our team. We have a multi-stakeholder team, myself representing the academic partner, my colleagues from Southeast Health who serve as our health system partner, and then the key behind this particular solution we propose, which is Intelligent Automations Incorporated, who serve as our technology solution provider. And so with respect to this, there are a number of things that we'd like to point out here that Eastern Health brought to the forefront in terms of the challenges that they were facing with respect to COVID-19. COVID-19 has impacted every aspect of our ecosystem, from patients to distributors to manufacturers, even with respect to having payers scrambling to try to figure out how we're going to deal with this. This is not an isolated issue that affects only a single payer system, but it also affects multi-payer system health systems as well. And so when it comes to PPE, how do we ensure that when supplies run short, that we can identify the appropriate equivalent products, and then most importantly, ensure that once we've identified the equivalent product, that we can actually find it. And so there are a number of healthcare challenges that were brought about and supply chain challenges that were brought about by Eastern Health, not to mention these four here on the screen. So how do we address these while at the same time tackling and battling these five pervasive supply chain challenges across the globe, trying to improve supply chain risk visibility and mitigation techniques, harnessing data, valuable data from a very disparate sources that provide multiple sources of truth, and also proactively approaching to ensure that we have equilibrium between supply and demand. Well, welcome and introduce Diffuse. Diffuse is a product that is based on the latest and the greatest technology around artificial intelligence. And we don't just use artificial intelligence as a buzzword. Artificial intelligence, and particularly feed-forward neural networks, are at the core of what we propose. And what it enables us to do, it enables us to hone in on a particular product of interest of a health system, show them comparable products by comparing various product data, by leveraging data from manufacturers, leveraging data from data repositories, leveraging data from government and state entities to allow us to say, is this an equivalent match? And not only will we, in this case, begin to show an organization, here's a potential equivalent, we will show them the percentage of confidence that the diffuse system has in that product being an equivalent match. And what happens is now those clinicians, as well as those supply chain professionals, as well as those individuals who work in quality or in pharmacy, are on their way to making improved decisions more efficiently and faster. And so by way of several other things that we do, we're able to scale this regardless of the size of the health system, regardless of whether you want to look at this across a province or across the nation. Diffuse is absolutely scalable to be able to address those issues no matter how they're presented. How do we do this? What we do is we aggregate data across at least 9 categories and extract data from more than 50 sources, not including those local sources of data that the health system would actually have. And then with respect to that, we give each health system the ability to fine tune the frequency in which we can pull that data. Granted, some of that is dictated by the source where we pull it from, but every health system will have the flexibility to determine how up to date they want that data to be. How do we handle conflicts and reconcile that data? Well, that's pretty straightforward. What we do, because we use a variety of artificial intelligence, not just feed-forward neural networks, but recurrent neural networks. And we use sometimes long and short-term memory. And what that does is allow us to ascertain the reason for the data inconsistency or data integrity issues. And then based on that, Diffuse will appropriate and leverage the appropriate analytics mechanism to help reconcile that data to ensure that at any given point in time, that health system can have a high level of degree of confidence. Let's take this one particular case study here. An organization trying to identify a comparable product here. Not only do we show them a list of products, but we also let them know the potential risk level for that product not being able to supply. And then we don't just leave you there if you're a supply chain professional. We take you one step farther where we begin to show you what's the reason why that particular product is at a high risk for not being supplied. And then in addition to that, we allow you to do what if analysis, change this, change that, and see what impact it actually has. So having said this, you can see Diffuse uses state-of-the-art characteristics based on leading industry and academic practices to identify the most important components of risk and then put forth an easily and seamless solution that can be used by any particular professional, whether you're a novice or whether you're extremely experienced, whether you're in supply chain or whether you're a clinician. DEFUSE is the right solution for you. We look forward to your questions.